Storm was a male Rottweiler that came into our lives when he was 6 weeks old. He was number 4 out of 5 Rotties that were part of our original pack of 10 before we were officially operating as a rescue. True to the breed, Storm was strong, confident, protective, and very loving with his people. He was alpha dog amongst his canine family and was respected by all of us. And as every owner wishes for their dog, Storm was healthy throughout his life. When Storm was 10.5 years old, he started favoring his front right leg with strong evidence of pain in the elbow. Unfortunately, an X-ray revealed a clear-cut case of osteosarcoma, or bone cancer.
Our Storm presented with a swollen elbow, and what we did is we could feel a hot swollen elbow. He was having a lot of difficulty with bending it. And on X-ray, you can see quite clearly here, you're starting to see what we call osteolytic bone. It kind of looks all moth-eaten here. And this is the proximal ulna, kind of which would be the point of your elbow here. And you can kind of see it starting to be eaten away. These are cancers that basically start lysing bone, start eating it away. And what will start happening is he's going to end up with a pathological fracture here. This bone is going to start to weaken until it starts to break. Okay, so you can kind of see on the radius this normal-looking bone here. These are the cortices and the marrow, nice defined edges to the bone. And then you get to the ulna here and you see all of this kind of hazy, moth-eaten look, and that's pretty classic of an osteosarcoma. And these are quite painful, aggressive cancers. Short of removing the limb, there's not a lot you can do, and of course there's a really high chance even with amputation of metastases. So the survival time of these guys is, even with amputations, not much more than 8 months. But pretty classic bone cancer of a Rottweiler, which we do see a fair bit of, unfortunately. The area is a little bit unusual for some of them to see. We tend to see a little bit higher up here in the humerus and down lower on the radius down the wrist. So the elbow's not as common, but... So here's Storm with his ball, having some fun, I guess, with that. But so this is the elbow in question right here, and it's hard to appreciate the swelling right there, but you see him short-stepping it? And then he's going to try to avoid flexing that elbow at all costs. He's very minimal flexion on the elbow. And you see him using the left elbow. He'll use it to get down, and he just drops himself there. So he's having quite a bit of difficulty and pain with that elbow. And that's very classic of osteosarcoma. That I think at this point he's also on some medication, right? We're masking some of the pain, but osteosarcoma is the most common bone cancer of the dog, and it is malignant, and it is invariably fatal, pretty much. Again, unless you really get lucky and you're able to remove the limb before it has a chance to metastasize. But there hasn't really been much success doing chemotherapy on this type of cancer to date, anyway. So.
For a month and a half, with the assistance of pain relief and anti-inflammatory medication, Storm was able to maintain a good quality of life. But there was also no mistaking that his leg was getting worse. And so, before we put Storm in an unbearable position, we made the only decision that could be made. Storm was just about to turn 11 when he passed on.